Dr. Vikas, are we ready for it? Great. So thank you once again. We'll be showing it on the screen itself so you can remain seated wherever you are and see the demo.
You can contact these guys later. We are not here to talk about money. Gloves दे दो. 7.5 है. Clean कर दो उसको. So we have to clean the area with the spirit swab. So we usually use normal saline. For dilution, we can use distilled water also, but that is a little painful for the patient. Syringe. हाँ, इन पे focus कर लो. So you can see how much blepharospasm she has. She can barely open her eyes. किससे कर रहे हो आप? सिर्फ स्टेरिलियम से कर लो. हाँ, वो ले आया क्या मेरा असिस्टेंट? मैंने मंगाया था अपना स्टेरिलियम भी ना, इसी से कर दो. स्टेरिलियम के लिए बोला था मैंने, मुझे इनका ये यूज कर रहे हैं. ये इसी वाले स्वाब से कर दो. So this is a 50 unit vial. So we are using 2 ml syringe and we take 1.2 ml of saline. Why 1.2 or 1.3 ml? Because you know a part of this remains in the hub of the needle. So we take around 1.2. And you can see, camera focus करो यहाँ पे. इधर मेरे इस पे syringe पे. So you can see, yeah, this is NS. It has gone inside by itself. If this doesn't happen, just discard the product. That is not going to work. This should happen. Yeah. Syringes दे दो. आप इंसुलिन भर के ले रखो. 10 units की. So we just shake it very lightly. So this mixes very nicely. भर दोगे? So we are using insulin syringes. You can use 1 ml syringes also, and we can use insulin syringes also. स्टेरिलियम ले लो, उसका स्टेरिलियम. अब भर भर के देते जाओ मुझे. गॉज. ठीक है. So we usually use a gauze with sterillium. Clean it once again. Units? Okay. So we have an insulin syringe with spirit betadine, whatever you want you can use. I don't use betadine because it stains the skin. Light है आपके पास कैमरा की? लाइट है आपके इसमें? लाइट डालो अगर है तो यहाँ, यू वांट लाइट। ये वाली लाइट जला सकते हैं ऊपर वाली? आज फोन डाल दो। या दिस विल हेल्प। सो दीज आर द फ्यू पॉइंट्स। आंख बंद कर लो अब अपनी। यू गिव जस्ट अबव द लैश लाइन। उधर मुख कर लो। अब आप लोग यहाँ पे आओ, नीचे नीचे रखो। You all can come a little in the front. Come and sit here. Bring your chairs. पास ले आओ ना, आज यहाँ से डालो, मेरे पीछे से डालो। अच्छा, so we put it just above the both the sides. You will see. Don't worry. Abhi, wait. I'll show you. So you just give superficially. Just no, please, sir. Please don't come on the stage. Screen पे आना चाहिए ना, हाँ. You just raise small wheels, 2 to 4 units you give, 2 points, then you give here, remain away from the levator. Yeah, into the muscle, orbicularis oculi, and then again this side. So raise small wheels. 10 units already. Okay, and you give very little here. ऊपर देखें. Otherwise you can call very little you give here. Just 2 units. These points are very simple. You can get them all over the internet. ऊपर देखें. So medially also you give just 1 unit, or you can paralyze the inferior oblique. And this is the area for the crow feet. You have to give here also. So 10 units we have injected. Around 20. No, both eyes. So now you can see just above the lash line medially, raise a wheel. ठीक है बस here just below the eyebrow and here both the sides. बस आंटी. We are done. We are done.
How much time it takes?
You can see it hardly takes 5 minutes. ठीक है, आप बैठो. अब what you have to do is you have to tell the patient, आज आपको ये काफी करना है जोर से. She has to do it so that it spreads nicely. और सोना नहीं है आपको 5 घंटे. ठीक है, इसको मसलना नहीं है. या बैठो आप. So now we'll have our next patient. We have less time. So come. इनको बोलना मुझे कल आके मिल लेंगे. हाँ, जो भी गई है पेशेंट. पहले इनको वो लगाते हैं. अंडर आई लगाना है ना. अंडर आई है ना. So we'll. So he is for both tear trough filler and toxin, Xeomin. So you can see. अपनी lines दिखा. फोरहेड ऊपर करके लाइन दिखा, यहाँ फोकस करो, फोरहेड पे फोकस करो, फोरहेड पे, और अच्छे से दिखा, और कर, और ये वाली भी दिखा, इसको ऐसे, ये so you can see these, and he is a little nervous probably, so he's not showing you his lines nicely. Smile, smile, smile. So you can see his crow feet also. So we are going to do all this. You need the light, or yeah, we need the light. Give me the filler. So we are doing a tear trough augmentation for him, and we are using a balance filler, Belletero Balance. This is currently the best product available in India for tear trough augmentation. So you can see this, it is just like your viscoelastic, and you have to open it. कौन सा needle? 30 gauze? दोनों 30 है ना? 27 है. So we have 27 and we have 30 gauze. I'll use 27 gauze. So this is how you screw it, and you have to screw it very tight. Otherwise it will come out. See. Clean कर दिया अच्छे से. I'm using 27 gauze. I just told you. This is filler only. ऊपर देखें. इसके पीछे आपको अब आ जाओ support.
Actually, this is not a proper chair. You can use it on your
Ophthalmic chair. You need to rest the head of the patient. ऊपर देख ले. आँख खोल ले, खोले खोले, ऊपर देखो. So you have to feel the bone, feel the orbital bone.
like this now.
Avoid any vessels. So you have to go just above the bone.
So you have to go and
Feel the bone, and then you have to withdraw a little. It should not be in the vessel. And just give 0.1 ml.
0.1 ml bolus.
Same on the other side. Do it very symmetrically, unless उनकी तरफ देख.
इनका कंफर्टेबल, आप थोड़ा इधर उधर.
हाँ. Clean it, feel the bone, go inside, touch the bone, withdraw, inject. Come out. See how nicely this product modulates.
Now he also has
This scar, we can also lift this scar actually with this. ठीक है. He actually doesn't have very prominent tear trough deformity. Otherwise, it's quite visible, the transformation. So now we are going to give a little medially. feel the bone, withdraw, inject. Even if you see a lump, just massage it and it will very nicely distribute. ऊपर देखो, ठीक है? So we'll give a little laterally and then we will go medially. ज़्यादा की ज़रूरत नहीं, काफ़ी और नहीं, बहुत है। हाँ, कर दे देंगे। So now the last. बंद करके रख लो। इसका ना डिब्बे पे इसका नाम लिख लेना, आशीष। ध्यान से।
The stage is a little shaky.
Working under shaky conditions. So now we are going to होगा हो रहा है खड़ा. We are now going to do the upper face or forehead cosmetic Xeomin. ठीक हो गया? ये रख दी. अच्छा मेरे को ये गॉज और दे दो प्लीज. इसको मेरे बैग को बंद कर दो यार. वहीं रख दो. हाँ जी. So we are done with the tear trough filler, and now I will demonstrate to you a cosmetic Xeomin. This is given for the forehead lines, for the dynamic wrinkles, and this is a very popular method here. So this guy is very young, he is around 30 years of age, so he doesn't need much. And there is a basic difference which we do when we give to males and females. For females we give a brow lift. For males we don't want to give, like the brows become like this. The females like it, we don't give that to the males. So there is a basic difference. I'll tell you when I inject. So पहले ये करो इसको, ये हाँ ये वाली लाइंस बनाना. मेरे को देखो, ऐसे करो ऐसे.
इस तरह से इसको दोनों वैसे करना जोर से.
हाँ. So here we give into the muscle, in the glabella and the process. We inject around 10 to 15 units here. ये गॉस लेके आ जाओ ब्लीडिंग रोकने के लिए. हाँ करना, दोबारा करना. Both the sides. कर.
So you basically have to inject inside the muscle.
मार्किंग पेंसिल है देना.
So I'm just marking the points and showing you forehead line बनाना, ऊपर करना इसको और छोड़ा ऊपर.
So we inject at various points.
small doses for these lines.
So we won't be injecting very near the eyebrow.
So that will cause a brow process. So in females we just inject this V and we don't go here. So this part raises. While in males we go till here. So in males
More units are required, and also because male forehead is more muscular.
it depends on person to person. So I am just raising small
Wheels. और तैयार रखना ये. बस थोड़ा थोड़ा. ठीक है. फोरहेड सपोर्ट कर दो. ठीक है. ठंड लग रही है. कितना है इसमें? खत्म हो गया. क्रोफिट करने हैं ना. दूसरा कर लो. क्रोफिट करने हैं, बना लो उसको. ऊपर करो. हाँ. Just inject between the lines, not into the lines. करना ऊपर करना. बस हो गया हो गया. So we are done. So now we'll go for the crow feet. देना बनाए अभी बना रहे हैं. We have finished around 50 units. Now we are just opening the other vial. हो गया हो गया. अभी मैं और भी रख रहा हूँ. You call the patient after a week. The effect usually starts coming after 2 or 3 days and almost complete by 5 to 6 days. You call the patient after a week. It is always better to under inject at first and then you assess and then you do a touch up. आपका पेशेंट इसके बाद पैराकिन आई ड्रॉप्स रखे थे मैंने यहाँ, है ना, डाल दिए. Yeah, we don't have a patient for hemifacial spasm. The same as blepharospasm, plus you go in the cheek in the zygomaticus minor. उसमें you ask the patient to ऐसे करो, so you can feel the zygomaticus minor, and usually you go wherever there is a tremor, you can give it. ठीक है? You don't give much here in the cheek, maybe 2 to 4 units. Otherwise, that can cause a face drop. सेम वैसे ही देंगे. हाँ वो तो करना ही है. हाँ हाँ. Yeah, 10 units are good enough. Smile करें. See, now you can see he has very prominent crow feet he has. So you just inject between the crow feet at 2 or 3 points. Both the sides. Smile, smile, smile. हो गया? फिनिश. ठीक है. वो लगा दो, बिठा के ना, नीचे बिठा के एंटीबायोटिक लगा दो. दोनों को लगा देना. So we are done. We have one.
Have any more patients? Last. क्या लगाओगे? Look में. So we have a patient for a lip filler. We have a volunteer. Lip filler is very popular these days among young girls.
क्लीन करा? कौन सा दे रहे हो प्रोडक्ट? बैलेंस दे रहे हो या इंटेंस दे रहे हो? इंटेंस ज़्यादा थिक तो नहीं होगा इनके लिए? ठीक रहेगा? प्रभात कहाँ है? बैलेंस एक ही लाए थे।
This young girl sitting here is also an ophthalmologist. So, sorry? Sir, disease is called vanity.
बैलेंस नहीं करता मेटल क्या रहता है?
Yes, yes, of course. You know,
ये वॉल्यूम नहीं करेंगे इनका।
we'll see it right here. Yeah, of course. So that is no fillers.
और कोई नहीं।
Right now, what we are doing here is filler. Yeah. So purpose is only cosmesis. Yes, yes, of course.
We don't use this word here in this workshop. Xeomin.
Botulinum toxin.
This is sponsored by Xeomin, so don't use that word which you are using.
So here,
right?
here it is Xeomin.
We are used to using that, so we are also consciously avoiding. So we are doing a lip filler.
She was anesthetized earlier. She did it herself. She knows
Needle
what.
though, needle. ये 30 है।
So Dr.
27
Ina,
है।
while you are waiting, you can smile. You are on
27 use
TV.
करें ना इसके साथ तो। ये आपने मुझे इंटेंस दिया है ना? कौन सी नीडल दे रहे हो? 30 इसमें निकल जाएगा 30 से चला जाएगा।
Good, very good.
थोड़ा फोर्स ज्यादा करना पड़ेगा। क्या दे रहे हो? लगाऊं? ठीक है। एक बार क्लीन कर दो उससे, स्वैप से कर दो। In this, they have given me a 30 gauze needle.
So Dr. Vikas, any specific reason for differentiating here? Because the skin is thinner, you are taking a smaller.
Yeah. Actually,
As
you have
against
to know the
27.
anatomy of the lip basically. So you have a cupid's bow on top of the lip. Then this is the vermilion border. Then these are the two tubercles. Then two tubercles here. So filling up a lip is a very artistic job. It should not be done by beginners. First you should start by nasolabial. Nasolabial is the easiest. And then you should go to tear trough. अब ये निकलेगी नहीं। ठीक है। Light. So first we are filling up the border. Are you okay? You can see how nicely, you can appreciate from there, this shape. Don't touch, don't touch, don't touch. थोड़ा इनका सपोर्ट कर दो, हेड सपोर्ट। मिरर दे दो इनको, मिरर. For a cosmetic patient, his or her opinion is very important, what she wants. You show them the mirror in between. So now we'll go down. ले लो, देख लो, अपर बॉर्डर्स हो गए हैं, ठीक है. हाँ वो भी करना है, करते हैं. I'll do that. Just look up. So you make the philtrum. In her, the philtrum is a little absent. So I'll just make it. See, can you see? दिख रहा है वीडियो में, दिखाओ. This is coming up. So if there is any oozing, you can just give a little pressure. Gauze ले लो. आप ले लो गॉज उसका. ठीक है, ठीक है. अभी और लगाएंगे, वहाँ पे भी हुआ नहीं है. नीचे करें, हाँ, फिल करते हैं. So now we fill the medial and the lateral tubercle. Look up. फोर्स लगाना पड़ता है पतली नीडल में. ठीक है. So now we do the borders. This what? इधर लगा बॉर्डर.
believe now you can appreciate the difference, immediate difference which has occurred. So here it will not be needing to pout for selfie, it is already there. Right? Sir, this is not German.
पूरा होने दो अपना, फिर देखना. सॉरी. लोअर में ही लग रहा है। बस 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 बस। इस साइड करना है, उस साइड भी है। ये लाइंस थोड़ी कर देते हैं आपकी ऊपर वाली बस, ठीक है। और कहीं लग रहा है आपको जरूरत है? अपर लिप में डालें, अभी हो जाएगा ये। इट विल। अपर में डालें थोड़ा सा, ठीक। कर दो तो कर दो, ये निकल ही नहीं रही बाहर। आप निकालोगे? ये आएगी नहीं, टाइट हो जाती है। आ गई।
are now almost done. So I'll just show you the philtrum and the Cupid's bow which we have made. There was no philtrum in her initially. Now you can see it is very much visible. Now, can you see that these two raised lines? So now Miss Ophthalmology is ready for Miss Ophthalmology India and Miss Universe. और नहीं लगाना, देखो इधर अपन लिड में अब चाहिए, टच मत करो. So we put little here at the corners of your mouth, जो lines आ रही हैं ये चली जाएंगी. So we are just putting little at the corners of the mouth to raise the lips. This gives a youthful look. And a little here. Yes, yes, yes. Lip is actually painful. She is very brave. She has got it done without anesthesia. So if you have any more questions you can ask me. Dr. Vikas. We also give Xeomin is mostly used for the upper face. We also use it in the lower face for drooping angles of mouth. We give 2 units of Xeomin here, 2 units here, and also people who have good masseter muscles. We can use see. If a patient's angle of mouth are drooping, either we can use filler and we can also inject 2 units of Xeomin here in this area. Or people who have a square face, usually people like Kareena Kapoor. So square face is more masculine and it is present in women and also people from northeast races. So we inject, feel the masseter here and inject around 25 units. So that gives a round face. ठीक है, एंटीबायोटिक लगा दो. Thank you.
सर योगिन के बाद पेशेंट होने के बाद कितने दिनों तक
1 month you can keep it in the fridge.